Are you using bundles of tissues just to clean your runny nose? Hi friends, I'm Dr. Rachana Gaddipati and I'm going to talk to you about runny nose today. I think it is pretty self-explanatory. Any discharge that comes out of your nose is runny nose. The discharge can be very clean, it can be dirty, it can be thin, it can be thick, it can come from one side, it can come from both sides. Most common cause of runny nose is allergy. The other causes of it can be DNS, that is a deviated nasal septum, or hypertrophic turbinate, naak ka maas badna. Sometimes it can be due to sinusitis. General irritants can cause a runny nose. The duration of a runny nose will depend on the cause of the illness. If it is an allergic cause, it lasts as long as the exposure is there, or can last for a couple of minutes after exposure. If it is a mechanical cause that is due to an obstruction or a foreign body, which is more commonly seen in children, then it might last for as long as the obstruction is present inside the nose. When we talk about prevention of runny nose, it is more about prevention of allergy or identification of allergy. Friends, I would ask you to start maintaining an allergy diary either in your phone or in your book. Try to identify what your triggers are. That is something that your doctor can't do for you. That is an effort that you will have to put by yourself. So how do you do that? Notice your symptom. Allergy symptom can be anything. It can be a itchy nose, it can be a runny nose. The water from the nose doesn't always have to come from the nose. It can even fall back into your throat, causing itching inside the throat, which is also a runny nose. To prevent a runny nose, like I said, first identify your triggers. Once you identify your triggers, you can start cutting them out of your life. General preventions that you can take, what the general triggers are, like winters are coming, so when you wake up in the morning, make sure that you don't step on the cold floor. Use either slippers or socks when you get up. Make sure that you don't directly go into a very cold environment if you're using a heater in your room. When you brush your teeth or wash your face, use lukewarm water instead of very cold water. Avoid spending too much time in water or in moist surfaces. Always use a mask when you're stepping out. Always use a mask if there is any trigger around you. Once we identify the source of the nose, then the treatment becomes very easy. If you're looking for home remedies, the best thing that you can do is yoga, start doing breathing exercises, start washing your nose through jalneti. Washing your nose really helps to blow out whatever allergens are inside or the excessive mucus collection that is present deep within your nose, and your sinuses are always washed out. Otherwise, if it is not controlled by home remedies, then I will request you to come see a doctor. Doctor will try to identify why it is happening, and depending on that, there are various treatment modalities that we use. Treatment for allergy can be either medical. In cases where there are complications, then even a surgery can be advised for the patient. It all depends on where the patient is symptomatically and what we find in the reports or the scans of the patient. So treatment for rhinitis or a runny nose is very patient-centric. Once we identify what the cause of the runny nose is, then we treat it accordingly. Mostly it is medical management. Sometimes if we find complications of allergy like polyposis or sinusitis, that is when the patient is prescribed a surgical management. Friends, I hope this video has helped you in stopping and piling on the tissue and increasing your carbon footprint. Please identify your source. If not able to, visit your doctor. I hope this video has provided you with valuable information. If you like the video, please like, share and subscribe. Thank you.